So when it comes to addictions, clearly we're not succeeding very well in treating it. The relapse rate amongst people that come into therapy is very high. What I was saying is that our treatment modalities are not working very well with addiction. And I don't have to give you the statistics, but there could be two reasons for that, at least. One of them is that addiction really is this really elusive, refractory, difficult to treat disease. That's one possibility. And it's just, we can't do any better than we are. That's one possibility. The other is that perhaps our approach to it is not appropriate. Maybe we don't understand it. Our perspective on it perhaps is limited. No addict I've ever worked with, no addict you will ever work with or have worked with, ever woke up one morning and decided to become a drug addict. It's not a matter of choice. It's absolute nonsense to say so. So let's just be done with the choice idea, accept that the whole legal system is based on it, which immensely complicates our work because our clients are forever taken to court under the assumption that they've chosen behaviors that are against the law and for which they should be punished. And that whole punishment modality immensely complicates, in fact, undermines any therapeutic work. So much for the choice idea. Now, the medical perspective on addiction is that it's a brain disease. So the American Society of Addiction Medicine defines addiction as a chronic primary brain disorder, disease of brain reward, motivation, memory, and related circuitry. And according to them, genetic factors account for about half of the likelihood that an individual develop addiction. So fundamentally, it's a largely genetically programmed propensity that then develops into a chronic brain disease. So basically what we're talking about here is addiction is a neurobiological disease of the brain, largely potentiated by genetic factors. One way to look at addictions then, and I'm looking at it from different layers. So first of all, as an attempt to solve a life problem. On the second level, as actually self-medication of what we call concurrent conditions. So if you deal with a population of stimulant addicts, and if you don't screen them for lifelong ADHD, you're just missing a big clue about the source of their addiction. Everything is said here the way, at least if I'm not over-interpreting it, the lack of a positive self-image, the lack of excitement, vitality, the presence of pain and stress, the lack of sufficient pleasure, these are trauma imprints. Trauma is not what happens to us, but what happens inside of us as a result of what happens to us. And that trauma is manifested in the disconnection from self, all of which these qualities that you folks brought up represent is a disconnection from the self. Addiction is a response to trauma, and it's an attempt to solve a life problem. It's not the primary problem, it's the secondary problem. And ultimately, we have to address the primary problem to really help people recover from addiction.